My name is Bjorn Lobo. I'm a neurosurgeon and I focus on spine surgery and also brain tumors. I treat the wide array of spine pathologies, including spinal stenosis and degenerative disc disease. Right now, my practice is focused on regaining as much functional outcome for the patient. So I've been focusing on doing operations such as disc replacement operations in the outpatient setting, so the patients still regain that motion that they had before the pathology occurred. I had some life experiences when I was in high school that focused me onto the nervous system as far as what I wanted to understand. After high school, I went to a combined undergraduate and graduate program. It's one of 6 in the country that provides a 6-year accelerated training. And after that, I was fortunate to get into Cleveland Clinic, which was at the time the top 4 hospital in the country. After Cleveland Clinic, I came out here for a 1-year fellowship in Santa Monica in minimally invasive surgery. And then I've started in private practice immediately after. My focus when I was in residency was a lot of brain tumor surgery. When I got out in practice, I really found out that my passion for spine surgery was growing. My goal is to fix patients' issues so that they don't come back in 5 years with another problem. It's so that they have a one and done surgery and they have at least the amount of time for recovery as possible. Well, we found that in order to achieve a better outcome for our patients, we needed a partner that was really going to help us promote minimally invasive surgery and really be a center that's going to be part of the patient education and that we feel comfortable doing operations at. DISC has really filled that role. DISC is a center that's known throughout the world as a minimally invasive pioneer, and so we really feel comfortable bringing our patients to the DISC centers because we feel that they really do help improve the outcome for patients in general. Dr. Leiker and I are really pushing minimally invasive surgery in the area to really give that opportunity for the patients to have a world-class level of care without leaving and traveling too far out of their own home door. I have a new baby at home, so predominantly my home life is taking care of the child. I mean, he's an adorable 18-month-old right now, so it's a lot of fun, but he's a lot of work. So that's been basically our whole life. My favorite part of the job is seeing a patient come in after surgery, and they are just, cheek-to-cheek smiles because they cannot believe how well everything's going. And the most common thing I hear from patients is saying, I was so scared of surgery, why did I put it off?